Good afternoon, everybody.
Afternoon.
Good afternoon.
How's everybody doing?
Good.
Good.
Yeah, people hungry. Oh.
Patrick, you are in the other section that's now with Professor Kershaw. I know
Really?
she sent an announcement a few days ago. This double section that I originally had, one of the sections went to Professor Kershaw, and you were in her class. So go back to your announcements and look at the email she sent. I think it was the header was change in instructor.
Okay.
Okay. And it
What
has
should
her.
I,
Did you find
what
it?
should I do now? What should I do now?
So get off this Zoom and go into her Zoom.
Where is it?
This is just for Patrick.
Or what was her Zoom ID?
I don't know. I don't know it off the top of my head. You'll have to look in your announcements.
Okay.
Okay.
A class that I want to?
Yep. Same time. Yep. You're just switching over Zooms. So it's in your announcements. She sent an announcement about that.
All right.
Okay.
Okay.
Okay, Brianna, I got your message a little bit ago and I sent it back to you about the quiz. Lara, where's Lara? There you are.
It's Laura.
Laura. Oh, okay.
It's
You
spelled
s-
correctly.
That's okay. You sent me a message about the PowerPoints.
Yes, I couldn't, let me see, I
So,
couldn't access them through the announcements, but so I went through the modules on the chapter 1 that you said and the other chapters for week 2. Are those the same PowerPoints or are those different?
nope, those are the same. So you should be able, because hang on one second. I need to, Lexi. Okay, we have a few students in here. Lexi, you are with Professor Kershaw now. Or did you already? So Lexi, you need to go back and take a look at your announcements. The section has been changed over to Professor Kershaw.
You know why?
Do I know why? Because I had a double section and Dean Brown took the other section that you were in and moved it to Professor Kershaw.
Oh,
Pardon me. So she sent out an announcement. And there was somebody else that came in.
Box that is selling on TikTok by some fake Chinese company. We're trying to get them. They have hundreds
I
of
think it
shops
was-
I'm in your class, Professor.
circling.
Who said that?
This is Hawa.
Who?
Hawa, Hawe. Hawa.
Yeah, you're fine. You're fine.
Okay.
Yep. There was somebody else that just came in.
Masana. I know this is my class.
When I pour this in a glass,
Yes, it's you. So you are in,
Hold
You-
the refrigerator.
um, you are in the other section, so you need to go into Masuna, you need to go into your announcements and get
Okay.
get Professor Kershaw's Zoom ID,
Mhm.
okay?
Okay.
Okay. So Laura,
Yes,
if you go through the modules and click on your week 11 and 12 PowerPoint under, I think, week 2, are you able to open those up? Because I was tutoring a few students this week and they were able to open it up. We were looking at those.
I did do the week 2. I went through the reading on that part and then I was able to go ahead and do that.
So I get, my
Um,
question is, were you able to open up the 2 PowerPoints in week 2
Yes.
from, oh, you were, okay, all
yes.
right, awesome, okay. Okay, need everybody to turn their cameras on, please.
Professor Marvel.
1 second, I just need to get a message to Tyan. Tyan, you are, can you hear me? Tyan,
Yes.
you are in the other section. Your section has been switched over to Professor Kershaw. If you look in your announcements, there is an email from her with her new Zoom, her Zoom.
What day is that then?
It's the same class. It's right now, but you need to go onto her Zoom. You're in the other section.
Oh man.
So go into your announcements.
Okay.
Okay, and get her Zoom ID and log off this Zoom and get onto her Zoom.
Professor, do we need a second device right now for our quiz?
No. No.
How I'm doing?
Okay. So welcome everybody to week 2. Did everybody have a nice long weekend?
Yes.
With your lips.
Okay. So we will I have 2 more students coming in. Devion and Maisha.
I'm here. I want to ask about the Zoom code. Is it always going to be in week 1? Because I was looking for it to be in the week 2 announcement. Is it going to be the same code as week 1?
Yep, it's the same code all the way through.
All right, thank you.
You're welcome. Okay, I think we have everybody. Okay. So you should all have quiz 1 in your module. Does everybody see that?
No, I don't have it in my module.
I don't have it either.
Nobody has quiz 1?
I clicked on it, but through the grade book because it wasn't on the module.
Okay. You accessed it through the grade book?
Yes.
Okay.
I don't have it as well. So you got to go through the grade book to get to it.
All right, so for now, since the quizzes are all updated, everybody go through the grade book. And pull up your quiz 1.
Grade book.
Yeah, through the grades, Charmaine.
who has not been able to pull it up under the grade book?
Let's see. It's in week 2.
Mm-hmm.
I'm not familiar with that.
Shall we start?
Yeah, 1 second. Let's make sure Charmaine gets it.
I don't have it yet. Let me see. Okay. Sorry, guys. Quiz 1.
Got it?
Yes.
Yes.
Okay. So this is a KGA assignment, so it has to be proctored, which means everybody has to stay on camera. We'll do 15 minutes. Okay, so it's 1:06 now, so we'll do to about 1:20. So everybody mute themselves. Okay, go in and take the quiz. Is the first question of the quiz community-oriented nursing? Okay, all right. So you have the updated quiz. All right, so go ahead and start, and then we will review the quiz. And then we'll go on and cover content from weeks 1 and 2, the concepts. Okay?
Mhm.
So go ahead and get started. Now, stay on camera when you're done. You still need to stay on camera. Okay? Hey, how's everybody coming? Looks like I still have about 5 or 6 students that haven't submitted yet. Are you still working on it or did you forget to submit? Is anybody still working on it? Nobody's still working on it, so everybody needs to submit. Please.
I'm still working.
Okay. How are you still working on it?
I got 2 more questions.
Okay. Okay.
Do not limit.
No, that's
to
okay.
the-
That's okay. Just double checking. Josephine, are you still working on it?
No, not anymore.
Okay. Did you submit it?
Yeah.
Okay. And Asata, are you still working on it?
No, I already submitted.
You submitted. Okay. Okay, if everybody could come back on camera, I would appreciate it. Debian, I can only see your forehead. There you are. Kamira, if you could get back on camera. Jay Laquan, if you could come back on camera. Thank you. How are you all done?
Yes, I'm done.
Okay. Okay. How'd we do? Did you guys you got your score, right? Did you get the questions that you missed? Yes, no?
No,
I'm
I still
confused.
can't find that 5 functions of the family, and the 2 things that I printed out for the study guides are stuff like this. And it doesn't have anything about that in either one of my study guides. And when I go through your blueprint and go to the blue underlined, it says access denied, which is why I was asking if they were the same study guide.
So if
same
you
PowerPoints.
if you look in your week 2 blueprint notes that I sent,
I did.
okay, it's under family nursing, family health risks on page 4. You see it at the
Okay,
top?
thank you. Yeah, I see it. Thank you.
You're
I was
welcome.
looking at my PowerPoints.
Oh,
So where was that at?
page 4
Page 4.
of your week 2 blueprint notes
Mm.
under the heading of family nursing, family health risks.
I was still in week 1. Mm.
Did you see it on week 2? Did you guys have a look at your week 2 notes? Because
Why
this,
wouldn't
this class covers week 1 and week 2.
but we really didn't go over
No, that's what I'm saying.
I'm sorry?
When I asked you last week what the quiz was going to be on and what to study, you gave us stuff from week 1, not from week 2. So that's
Exactly.
what it's focused
No,
on.
it's weeks 1 and 2. This is week 2. So remember I said in week 1, the purpose of the quizzes is to be given at the beginning of the class. Right? And hopefully you've done your readings and done your readings of your 2 weeks of weekly notes, weeks 1 and 2. And that quiz 1 covers weeks 1 and 2. And next week, when we take quiz 2, it will cover just week 3. Okay? I said that last week.
So is there any way when becomes our quizzes cover 2 weeks that you can actually give us the blueprint for the week ahead of time before the night before, so we have more time to study? Because we didn't get our blueprint for yet till yesterday at 9 o'clock.
Okay.
And that kind of determined whether or not we did good on this test when it records to week
Okay.
2's blueprint.
Okay.
It
I
just-
usually send those out on Sunday night. I did not. I sent them out Monday morning. So
Wow.
Well, that just seems like still a setup for like
Yep.
failure.
Yep.
If you know that we're going to be quizzed on this, we should have a week to prepare at least. So I feel it's in the class, because I sat there and I went through, I highlighted the blueprint, and now you're telling me that we should have studied a week prior when you didn't give it.
no, I didn't say you should have studied a week prior. What I said was quiz 1 was going to be covering week 1 and week 2 concepts.
That's still 2 weeks. So
Okay, so you have all the readings that's already set up in your module. You have all the weekly readings set up for week 2.
stop the blueprint.
Okay, the blueprint and the notes that were sent out yesterday morning.
I understand you're trying to listen to respond, but I need you to listen at the moment so we can have, a clear understanding, because I'm pretty sure others feel the same way I feel.
I feel the same way.
Okay.
So when I'm going through and I make sure that I have it prepared, so I'm studying before class, and what I'm seeing is not showing up, it's a little concerning. Seems like you're trying to set me up for failure, because that should have been about 2 days prior. 2 days prior isn't enough time.
Okay. I appreciate that. I
Everybody
appreciate
feels
that
the same way.
feedback.
There wasn't enough transparency on what we needed to look at. If I would have knew I needed to look at week 2, I would have. I thought that the quiz was going to be on week 1, and you saying that you didn't get that information till Monday morning.
Well, what I didn't get you until yesterday morning was the blueprint notes, but you had all the readings to do ahead of time for week 2. They're listed in your module, right?
Professor Marvel, can we go over the quiz?
Yeah.
Yes,
we're
please.
we're gonna do that now.
And the reason I asked you that was because, like, I remember one of the questions, and it just seemed so contradictory to. We had P's before this class.
Okay.
And it seemed so contradictory to what was said by the instructor in P's as far as a child with ADHD and what should not be done.
So when that question comes up, let's talk about that. Charmaine, okay? All right, great. Okay. So question 1, which is an example of community-oriented nursing? So from your readings, in week 1, it was in the module, your introduction to community-oriented nursing. What did you guys learn about the difference between community-oriented nursing and community-based nursing? Before I go over it. What's the difference?
She did say what the difference was.
Community oriented is it specific to that community?
Community-oriented what?
Is specific to that community?
Okay.
Things that are happening in that community.
Okay. Okay, and what is community-based nursing? So this is the idea. Go ahead.
Like a program it's like a program set up for a specific thing in the community?
Okay, so community-oriented nursing, if you look in your week 1 notes, community-oriented nursing is focused on the whole population. Okay, you're looking at programs, or you're looking at the community as a whole. Okay, where community-based nursing, the way I remember it, is you're based in the community. So you're taking care of clients in the community. So that could be a school nurse, that could be hospice nurse, right? You're community-based, you're based in the community, home health nurse. Okay, so which is an example of community-oriented nursing in this first question is C. Okay, evaluating the outcomes of a community vaccination program. Everything else is community-based. Okay, community-based is A, illness care of individuals in the community. Okay, educating the child and school teacher on the use of an inhaler. Okay, that's community-based. Home health care delivery in the community. Does anybody have any questions about that? Because we need to understand the difference between community-oriented and community-based. So community-oriented, you're trying to orient yourself to the entire community, the entire population. Okay, it's primarily focused on health promotion rather than illness care.
Yeah.
So you're focused on the whole population versus the individual.
And what you say base was, community based?
Community-based is you're in the community taking care of clients, illness care. So that would be the home health nurse, the hospice nurse, the school nurse, the occupational nurse.
So I understood it.
Right, you're focused on illness care rather than health promotion.
Illness care rather than health promotion. Okay. And
Okay.
health promotion is community.
Yeah. So I always think of it as community oriented. You're trying to orient yourself to the whole community as a whole. Where community based, you're based in the community taking care of clients.
Mm.
Okay. Number 2. Which describes the purpose of Healthy People 2030 campaign. Okay, this is in your week 1 notes on the second page. Okay, under the heading of Healthy People 2030.
Everything, but it creates a standardized nursing curriculum.
Correct. Right. So if you looked on the website of Healthy People 2030 that was given to you as a link in week 1, A, B, and D all describes the purpose of Healthy People 2030. There were actually several. There were 5. Okay, there were 5 bullet points in your notes. Provides a framework to improve the health of all Americans. You think of it as a global, it's a national program. Attain healthy living, thriving lives, well-being, free of preventable diseases, disability, injury, and premature death. And that one of the other functions is promotes healthy development, healthy behaviors, and well-being across all life stages. Okay, it has nothing to do with creating a standardized nursing curriculum. Okay, right, so it is a national program to promote the health and wellness of all. Okay, question 3 has to do with levels of prevention. Before we even look at this question, let's talk about levels of prevention. Okay, here's the way I remember them. P is prevention, primary prevent, or P is prevention. So you're trying to prevent something before it even happens. S, secondary, is for screening. You're trying to screen for high risk. So early identification, early intervention. And T, tertiary, treatment. Okay, in the tertiary level, they have to have something. They have to have a disease or an injury or a condition. So you're treating something that has already happened, right? So you're trying to reduce symptoms of a disease, improve quality of life, give medications to treat a disease or treat a condition or treat a diagnosis. So if somebody has hypertension, you may be educating them on a low sodium diet. Right? If somebody has diabetes, you might be educating them on how to appropriately test your blood sugar. Okay? So an example of primary prevention would be A, prevention before it even occurs. Okay, what would B be?
That'd be screening.
Screening. So that would be secondary, right?
Secondary.
What about C? What would C be?
Treatment.
Tertiary.
Tertiary, management of a disease. And what would D be?
Would it be secondary?
Mm-hmm. Early identification, early intervention. So that's one of you're going to have quiz questions and exams questions about primary, secondary, and tertiary all the way through the term. Okay, and what we have to be able to do during this term is be able to identify primary, secondary, and tertiary interventions with each concept we're covering. Okay. Just doing a spot check here. Promise, I can't see you. I'm just looking at your wall. If you go back on camera, I'm just looking at your forehead. Josephine, I need you to be on camera, please. Promise, can you pull your camera down so I can see you? There you are. Okay. Josephine, I'm not able to see you. There you are. Okay. Question 4. Which client is not considered to be part of a vulnerable population? You look in your week 1 notes under the section of Introduction to Vulnerable Populations. It gives you a list of what we consider vulnerable populations. Okay, what are the correct answers here? Or what is the correct answer of what's not a vulnerable population?
The 23-year-old with tuberculosis.
Okay. Overall, people with somebody with tuberculosis is not considered a vulnerable population. Yes, they have a condition, but they're not grouped into a vulnerable population. Why is A a vulnerable population?
Because it consists of
Pregnancy.
adolescent, teenage pregnancy.
Teenage pregnancy. What if that said a 26-year-old pregnant woman? Would that be considered a vulnerable population?
No.
No. It's the specific age because it addresses teen pregnancy, which is considered a vulnerable population. Why is B a vulnerable population?
Because they have PTSD and things like that.
A veteran. A veteran in general is considered a vulnerable population. Same with number C, right? So we'll go back to B. The age doesn't matter like it does in A with the 16-year-old. A veteran is considered a vulnerable part of a vulnerable population, as is a substance abuser. Doesn't matter the age. Substance abuser is considered a vulnerable population.
Please don't. Thank you.
Does anybody have any questions on question 4? And what are other vulnerable populations that are not even listed in here?
Incarcerated, chronically ill,
Elderly.
Elderly, children,
Non-speaking.
non-speaking,
American non-speaking English.
Yep. Yep. So there's lots of vulnerable populations that your notes identify. Okay, which of the following are considered nursing interventions in the care for vulnerable populations? Select all that apply.
All of them.
All of them.
All of them.
Mhm.
These are all interventions, and this question comes right from your notes in week 1, your blueprint notes. Obviously, we want to increase resources, reduce health risks, assess the amount of stress, and reduce health disparities. Does anybody have any questions about question 5? Okay, resiliency. Which statement reflects the term resiliency as it relates to vulnerability? What does resiliency mean?
That is confined to a specific risk, a specific, like, is it, would it be something like, preventing, like COVID or?
Well, think about it. What is it, Charmaine, what does it mean to be resilient?
That you are not.
You're
just
not giving up,
Yeah.
right? You're not giving up,
Mm-hmm.
right? So in your notes, under the introduction to vulnerability section, there is a whole bullet on resiliency. Okay, so one of the things we know about resiliency is the more resilient you are, right, it's going to reduce your vulnerability to certain risks, right?
Mm-hmm.
The lack of resiliency is going to create lots of issues. Okay, it may increase the likelihood that you'll get sick. It will increase the likelihood that you're going to have more risks. Resiliency certainly doesn't depend solely on genetic predisposition. And obviously it can be learned. And we'll cover resiliency in a little bit more detail when we get to the blueprint notes. So somebody that has a lot of resiliency is going to reduce their vulnerability for risks. But you have to understand what the term resiliency means in order to answer this question. And one of the things, because we work with so many vulnerable populations in the community, one of our tasks when we're working with clients is to try and increase their resiliency, right? Question 7. Which is considered one of the 5 functions of a family? So as I told Lara, she was looking for this, in your week 2 notes on page 4, under the heading of family nursing, family health risks, there's 5 functions of a family. And these are the 5 basic functions. Every family looks different with regards to each of these 5. Financial, well, which is not considered one of the 5 functions. The correct answer is education is not considered one of the 5 functions. You have financial, reproductive, socialization, health, and affective. And we'll go through that in more detail when we cover the notes. Question 8 has to do with school nursing, which was covered in week 2. It was school nurses, if the school nurse is practicing tertiary intervention in the school clinic, what is she doing? Let's review. What's tertiary?
Treatment.
Treatment. So what would be a tertiary example?
Administering a medication.
Correct. Because something's going on that they need the medication, right? An illness, a diagnosis, a condition. What's B? Is B primary, secondary, or tertiary?
Primary.
Primary.
Great. We're trying to teach good hand hygiene as a prevention, right? For getting infections or getting communicable diseases, hand, foot, and mouth, right? What is C?
Secondary.
Secondary.
And what is D?
Secondary.
Secondary. Both screening. Yep. Okay. Which would not be considered an appropriate intervention with a student for ADHD?
Assigned an aid.
Assign an aid. Right? Does that automatically need to happen? There's a few
No.
things. Let me cover this. Okay. Place that these are from your notes in week 2 under common childhood ailments in the ADHD section. Okay. Where we suggest correct interventions. Place the child in front of the classroom. Give clear, short directions rather than several steps, and repeat them often. Do not limit outdoor physical activity as punishment. Okay, those are all appropriate interventions, and the question is asking what would not be considered. Okay, the answer is D. Assign an aid to work with the student one-on-one. Now, granted, there may be some students that need that, but that's not an automatic intervention for every student with ADHD, that you assign an aid to work with the student. Charmaine, does that make sense?
Sort of, kind of.
What?
Sort of.
Well, what doesn't make sense? Go ahead.
We was kind of like, it came up in our lecture this morning, and placing a child in front of the class was my first is like ding, because it seemed like I think she said you don't want them to feel singled out by placing them like differently from the rest of the class. That would make them act out, or it was make them act out or do something else. But it was basically it would make the child with ADHD feel like they were just being placed different from everybody else in the class.
Well, from my perspective and from this class's perspective, it's placing the child in front of the classroom not to be punitive, but so that they can be more focused. Does that make sense?
It does. It makes a lot of sense. It's just, it was just something fresh in my head that I heard.
Okay, no, I appreciate you bringing that up. Okay, let's talk about acute conjunctivitis. What statements are true about conjunctivitis? And again, conjunctivitis was covered in your week 2 notes under common childhood ailments.
Everything but conjunctivitis is not typically treated with antibiotics.
Okay. What statements are true? Actually, B is correct. Okay, so bacterial conjunctivitis is more likely to begin in one eye and spread to the other eye. That's true. Conjunctivitis is not typically treated with antibiotics. Okay, it is.
It is.
It is typically treated. So A is correct, C is correct, and D is correct.
So all of the above then?
No, B. Which statement is true? A, C, and D.
C and D. Okay.
A, C, and D. Because it is typically treated with antibiotic drops. And they are able to return to school usually 24 hours after the drops have started. Okay. So questions, did going through it, does it make sense? More sense now?
Yes,
Yes.
Okay.
yes.
Okay.
Going
Oh.
through it, made me think differently about the question.
Pardon me?
Going through it made me think differently about the questions and why it was asked.
Let me go through the chat here real quick. I was going to. Okay. All right, let's go through our notes. Let's go through the content. Some of it we've already covered, but let's go through week 1 and week 2 content. Does anybody have any questions going forward about the quiz? Now, next week's quiz will be just on week 3. Okay, I could send the week 3 blueprint notes out early. I usually attach them with my announcements over the weekend, but I'm happy to send those out early.
Yes, please.
I'm
Please.
happy to send them
Thank
out
you.
today. I'm happy to send them out today if you'd like.
Yes, please.
Please.
Thank you.
Yeah, I'm happy to.
Thank you.
Yeah, you're welcome. You're welcome. All right, let's go through week 1. So the concepts we covered that we're covering for week 1 were the introduction to community nursing, levels of healthcare prevention, Healthy People 2030, and introduction to vulnerability. And as you saw, you had a question, you had some quiz questions about each of those topics. Okay, what I like to do in the blueprint notes every week, and I'm just copying and pasting from the syllabus, is all your readings.
Oh, no, what happened?
Okay, so that's there for you. And we talked about this last week. Where do you find your Canvas courses? Canvas reading, right in the module, right? It's built right into the module, right?
Yes.
Bless you.
Thank you.
Okay, so we talked about this, community-oriented nursing. You are orienting yourself to the community and the population. Primary focus is on health promotion rather than illness care. You're working with a whole group rather than individuals. Community-based nursing, you're in the community. Illness care of individuals in the community. Home health nurses, hospice nurses, school nurses, occupational health nurses. You're focused on illness care rather than illness care instead of health promotion and health maintenance. All right, so it's individuals as opposed to communities and populations. Okay, the other thing that's important to remember is public health. Let's talk about public health. Public health is the big umbrella. Okay, it's a specialty area of community-oriented nursing. Okay, public health looks at health science, health promotion, and the maintenance of populations. Okay, so public health and community-oriented nursing are often used interchangeably. Okay, so like community-oriented nursing, public health nursing is focused on prevention, preventative care. Okay. Levels of prevention. This gives you a good description. We covered this a little bit going through the quiz. Primary, P is prevention. Trying to prevent something before it even occurs. Prevention of an illness, an injury. Maybe you're educating kids about bike safety, so you're talking about helmets. Maybe you're talking about seatbelt safety with adolescents. Immunizations, trying to prevent the measles, trying to prevent chickenpox. Secondary screening, early identification, early intervention, right? So if we could early identify something, early detection, hopefully we can prevent complications and try and reverse course. So examples would be mammogram screening, blood pressure screening, pap smears. In the schools, we did vision and hearing screening, scoliosis screening, BMI index screening. Okay, trying to identify issues before they try to identify at-risk individuals and trying to early intervene. Tertiary management or treatment, right? Treatment of a disease or condition to reduce the symptoms, maybe to also try and improve the quality of life, medications, low sodium diet, for maybe low sodium diet and weight loss education for somebody with hypertension or obesity. Okay. The third concept covered was Healthy People 2030. Okay, as you can see, all these 5 bullets are their national objectives, their national agenda, right? To improve the health and well-being over the next decade. Believe it or not, we started at Healthy People 2000. Then we went to Healthy People 210, Healthy People 220. Now we're at Healthy People 230. And if you looked at their website, you can see how that has transpired over the last 20 years. Social determinants of health. Okay. We're going to talk about social determinants of health. Okay, so we know that social determinants of health, these are conditions in the environment, okay, where you're born, where you live, where you learn, where you work, where you have recreation, where you worship. Okay, so social determinants of health are grouped into 5 domains. Do you have economic stability? Think of your community as a whole. Do people in your community have economic stability? Is there access to quality education? Is there access to quality health care? What are the neighborhoods like? What's the environment like? What's the environment like in the neighborhood? Social and community context. What resources are available in the community for people that have needs? Okay, so here's some examples, right? All these 5 have major impacts on people's health, well-being, and quality of life. Okay, think about if you don't have safe housing, there is no public transportation, and you have no private transportation. Think about your neighborhood. Is it a safe neighborhood? Is it a crime-ridden neighborhood? Is it a clean neighborhood? Okay, is there racism, discrimination, and violence that goes on in your neighborhood? How's the education? Is there quality education or it's not quality education? Are there job opportunities? What's the unemployment rate? What's the income? How many people in your community live in poverty? Okay. In your community, do you have access to nutritional foods? Do you have big grocery stores? Or do you have smaller stores that you end up having to pay more? Do you have physical activity opportunities? Do you have rec centers? Do you have parks? Do you have walking paths? And what's the condition of the air and the water? You know, do you live near streams or rivers? Do you live near transportation hubs that may create poor air quality? And what's the condition or what's the language and literacy skills of your community? You know, do you have a large group of non-English speaking community members? How do you get to them? How do you teach them? How do you assess them? All right, so we know that social determinants of health, which is what we just talked about, can create wide disparities of health inequities. We just talked about some of these examples. People don't have access to grocery stores with healthy foods, right? That may raise their risk of health conditions, heart disease, diabetes, obesity, maybe even lower life expectancy. Okay. So social determinants of health come from Healthy People 2030. That's where they're identified. Vulnerable populations. Okay. In a geographical community, the entire population may not necessarily be vulnerable. Think about your own community where you live in now as you drive around, whether you work, school, grocery store, whatever you do. Think about what your community looks like. Okay. Are there correctional facilities in your community? Are there Native American reservations in your community? We know that these particular areas are vulnerable. Kids, why are kids vulnerable? Why do you think kids are vulnerable? Why are kids vulnerable? What do you think?
Because they can't advocate for themselves.
Correct. Why else?
They also might be poor, so
cannot
they don't
protect
have all those nutritional things available to them that more wealthy people have.
They may not have access to healthcare or a pediatrician. They may not have access to good schools or overperforming schools versus underperforming schools. They don't have anybody to advocate for them. Okay. Elderly is also considered vulnerable. Chronically ill is considered vulnerable. American non-English speakers are considered vulnerable. This was one of the quiz questions, just going through who's vulnerable. Okay, here's where we talk about resilience. Okay, resilience, the ability to risk succumbing to health issues. Okay, what is resiliency? Where does it come from? Can you learn it? Okay, resiliency is typically influenced by life experiences. Okay, negative events in childhood that aren't dealt with through whatever means, counseling, other approaches, can decrease your resiliency. All right, resiliency is having higher levels of confidence. Okay, those who feel in control of their own health and their own health decisions will have less health risks. Those who feel not in control won't do as well. Okay, those with challenged resiliency may have difficulty taking action or seeking care for healthcare issues or trying to engage in preventative activity. Okay, and then another word that's important when working with the community population is disenfranchisement. What is that? When you feel disenfranchised, what are you feeling?
Feeling of separation from mainstream society.
Yeah, feeling forgotten, unimportant, right? You're on the outside. Okay, there's no real connection, emotional connection with any particular group. Okay, some examples of populations, vulnerable populations that may feel disenfranchised: the poor, people living in poverty, homeless, migrant workers. Okay, and then here was your list here of your, just refer to the quiz question, some vulnerable populations: teens, veterans, migrant workers, severely mentally ill, substance abuse, HIV, Hep B, and STIs. Another issue that we deal with the vulnerable populations is poverty. Okay, so we know that poverty and low educational levels contribute to social conditions in which you're going to see your disparities. Right? If you're living in poverty, you often live in unsafe areas, work in stressful environments, have less access to healthy food, exercise, and you're much more likely to be underinsured or uninsured, which creates bigger problems. If you're uninsured, underinsured, you're less likely to seek preventative healthcare services. The kids may not have a pediatrician. We talked about social determinants of health. This is important to know. Poverty is the primary cause of vulnerability. So if you're asked about that on an exam, you know, what is the most important, what's the primary cause of vulnerability? The answer is poverty. Okay, education also plays a role. Okay, obviously the higher levels of education lead to better choices. All right, higher education also influences how you perceive your stressors, your crises in life, how you think about healthcare, access to healthcare, access to nutrition, right? Higher health education definitely increases self-confidence, and thus back to the resiliency, may increase the resiliency as well. Talked about veterans and military, right? Deployment can have a negative impact on the individual or family. Often more domestic violence and child neglect, child abuse is seen, right? Service members coming back from deployment may have trouble reconnecting with the family, right? Kids may have more issues at school with a deployed parent. Anxiety, peer problems, social issues at school, maybe depression, even suicidal ideations. Okay? Some outcomes of vulnerability without intervention, right? So one of our goals as a community nurse is to help the vulnerable populations the best we can with the resources we have in the community. Okay, without intervention, you're going to see higher rates of morbidity and mortality. You're going to see higher rates of chronic disease, higher rates of communicable diseases, TB, hepatitis, STDs. Vulnerable populations often have a higher mortality rate than the general population, maybe due to their living conditions, diet, health status. So what are some interventions for the vulnerable population? Okay, this is where your quiz question came from, right? So our strategies: increase resources, reduce health risks, and reduce health disparities. And this gives you, all these bullets give you other interventions for vulnerable populations. Okay, I highlight these. These are important too: showing respect, compassion, and concern. Right? With vulnerable populations, we cannot make assumptions. We need to let them tell us their story. How did they get there? Asking open-ended questions. Okay. So make sure you read through the interventions. Questions about those 4 concepts. Do you have a better understanding of those?
Yes.
Yes.
All right, let's go into week 2, where we covered school nursing, growth and development, common childhood ailments, which is what your discussion question was about. And for anybody still confused, your initial post is due tomorrow night. A lot of people have submitted. Don't forget, the guidelines include, you have to pick 3, right? But you have to do a 6-point teaching plan for parents for each of the 3 that you picked. I've had a couple of questions about that. I guess the directions aren't as clear as they need to be, but please make sure there's a 6-point teaching parents teaching plan for each of the ailments that you chose. Okay. Okay, school nursing. That's where I just retired from a few years ago after 20 plus years. What does a school nurse do? I can tell you when I started school nursing 20 something years ago, you know, students came for whatever, Band-Aids, medication, whatever, but school nursing, if you read in your module, the school nursing page, what do school nurses do these days? And you may have had interaction with school nurses if your kids are in school, and
I
what do
do
school nurses do these days?
Outreach programs. They're like a caregiver to the children, they educate.
In your notes, direct caregiver, health educator, consultant, case manager, community outreach. Direct caregiver, lots of tasks being done by the school nurse. Okay. Providing care for, let me pull that up. Sorry. Pull up your week 2 notes. Here we go. Okay, again, sorry. Here's the concepts to be covered. The readings I just copy and pasted from the syllabus. There's your PowerPoints and your Canvas readings. So school nurse, direct caregiver. I can tell you for me, when I was at the end of my last few years in school nursing, I mean, we were cathing students, both female and male. We were providing insulin, diabetic care, whether it be insulin pump, insulin shots, insulin pens, seizure monitoring, trach care, trach suctioning. You're doing everything. Okay, so as a direct caregiver, the scope of practice is pretty big, especially kids that were had major challenges in our center-based programs. Okay, health educator, we spent a lot of time in school nursing educating, whether we're educating teachers, administrators, parents, kids. That may be primary teaching, secondary teaching, or tertiary teaching. You know, kids with asthma, you're teaching them how to use their inhalers. You know, we're educating on the risks of the high schoolers, the risks of STDs, the risks of dating violence, right? The risks of obesity, the risks of smoking, the risks of drug use, all the way down to the preschoolers. No, good hand washing. Like I said before, with the kids, you know, maybe you're teaching them about safety, bike safety, using helmets. Adolescents, teaching them about driving and using seatbelts. And so health education is a huge part of the school nurse, right? Consulting, you know, we're always consulting with physicians, always consulting with the teachers, administrators, parents, trying to provide them the resources that they need. Right? School nurses also function as case managers. Case managers, we'll talk about that later on the term, but basically a case manager is the coordinator of care. Okay, when you have kids with complex chronic illnesses, the nurse is coordinating services. Let's say the child has an IEP, that individualized education plan, because they require services, whether it be PT or OT or speech, right? We're coordinating that within the school. You know, I had a school that had a huge center-based program with a lot of kids with complex chronic illnesses. I had to coordinate from the IEP all their services. Okay, and then community outreach. We're always participating, or school nurses participate in health fairs. Right? We had immunization days, vaccination days. Okay, providing parents of newly diagnosed diabetics or newly diagnosed seizures with community resources to assist them. Okay, so lots and lots of community outreach with the school nurse. And then here's a good list of the different kinds of prevention that the school nurse engages in. Okay, we talked about primary prevention, preventing something before it happens, right? Injuries, providing education to prevent injuries, prevention, providing education on the risks of substance abuse behaviors, the risks of disease with the immunization. Okay, secondary. Okay, we're screening. Okay, one thing I want you to remember about secondary, think of the school nurse, the school setting. Kids come in all the time with common complaints. Okay, headaches, stomach aches, fever, whatever, sore throats. Okay, but we as school nurses have to be able to take that one step further. Let's say you have a child coming in for several weeks. They're coming in at the same time. They're coming in with a stomach ache. Same time every day for several weeks. You've already called home to see if this is going on at home. It's not. You've already called, you've spoke with the parent. You have spoke with the teacher. Okay. What other things might be going on? Maybe they're trying to avoid class. Maybe they're being bullied. Maybe they're being harassed. Okay. So as nurses, you have to be able to take that thinking to the next level. Remember, you're screening at risk. Okay. So we're screening maybe for the presence of chronic illnesses, obesity, asthma, allergies, anxiety, depression. Screening for child abuse, neglect. Screening, doing vision and hearing screening, scoliosis screenings. Those are all secondary. Okay. And then here, identifying risks for bullying. That kid that comes into the clinic with the stomach ache for several weeks. Well, we probably know it's not a stomach ache anymore, right? Why are they coming in? You have to be able to ask those additional questions. You're screening for risk. Somebody need to mute for background noise? Okay. Tertiary in the school setting. This is one of your quiz questions. Medication administration. Right? That may be a function of what you're doing for a tertiary intervention. Case management. Right? The student already has an IEP. They already have some challenges that require services from school. Okay? Trying to work with students and parents and teachers on how to manage complex chronic illnesses. I did that with seizures, with diabetes, with asthma, with allergies. Okay. And then one of the other concepts we covered was family nursing and family health risks. Okay. What's the current definition of a family? What's the definition of a family? Is there a definition of a family?
It could be many.
Charmaine, what did you say?
Could it be many? Many definitions.
Yeah, family is anyone
Whatever
that is providing physical, emotional, or financial support.
Exactly. Whatever they say it is, right? Family is a group of people who provide physical, emotional, financial support to each other. Right? Non-traditional families are pretty much the norm now, right? And here's your 5 functions of a family. This is generic functions of every family. It looks different financial, health, reproductive, socialization, and affective. It looks different within every family, but these are the five basic functions. Within the financial function, are families planning for the future? Are they making good decisions? Do they have a roof over their head? With regards to health, are the parents or whomever the guardians are teaching healthy behaviors? Teaching health maintenances, helping to educate on the risks of substance abuse, the risks of obesity, the benefits of good nutrition. Reproductive, simply meaning, are we being responsible for the number of kids we're having? Can we take care of them? Can we afford that? Socialization function. Are we raising children to fit into society, to become productive, responsible, well-adjusted adults? Do we maybe pass on spiritual, religious, and cultural beliefs? And with the affective function, that means, are we creating a sense of identity and belonging through affection, through love, through time together, bonding activities? Okay? Failure to meet these functions leads to dysfunction, right? May lead to crises, right? Failure to meet these functions can be a strong contributing factor to future violence, substance abuse, mental health issues, anxiety, depression, maybe work as absenteeism, maybe unemployment, unsafe sexual practices. Right, so really what we're talking about is, what are the characteristics of a functional family and what are the characteristics of a dysfunctional family? Okay, we know that there's some family health risks. Okay, so typically disease develops in response to three areas: genetic risks, environmental risks, and behavioral risks. And when we care for the families and are doing our assessments of the families, we have to think of all three. Genetics. We are all born with certain predispositions. Some may be predisposed to heart disease, predisposed to cancers, predisposed to alcoholism, predisposed to premature birth. Okay, those have to be identified. Right, what about the environment? Think about family health risks with regard to your environment. What does the physical environment look like? What does the social environment look like? What does the political environment look like? Do you live in high crime neighborhoods? Is there pollution? Are there substandard living conditions? Are they high stress environments? Is there any discrimination based on race, social status, religion, immigration status? Is there a lack of financial resources, social resources, emotional resources that may lead to higher incidence of crises within the family? And behavioral is basically the life choices that you make. Okay, you choose what you eat. You know, you choose if you choose poor lifestyle choices, it may lead to chronic conditions, diabetes, hypertension, congestive heart failure, osteoporosis, and so on. You know, what does your diet look like? Do you choose to eat healthy or do you choose to eat unhealthy? Okay, families, parents play a really important role in modeling healthy eating and exercise, right? Kids grow up seeing this. They see the healthy behaviors or not healthy behaviors. Okay? Substance abuse, trying to limit alcohol, avoiding tobacco, avoiding illegal drugs. Right? What are you role modeling for your family? Okay, violence. Is there violence that goes on in the family? Are kids witnessing violence? And kids that witness violence or are victims of violence tend to have a higher risk of being violent later on. Okay, and then obesity. Talked about this a little bit. Rates of obesity in children have been significantly rising steadily. Okay. Not just from diet and exercise, but also from environmental exposures. Maybe exposure to certain chemicals or pollution. Right? We know, and we teach this in the schools, the consequences of childhood obesity are lifelong and increase the risk for so many things. Cardiovascular issues, respiratory issues, renal, menstrual, metabolic, on and on. Obesity in children also increases the risk of bullying. Common childhood ailments. Okay, we only have a few minutes left here because I want to stick to the time of not taking a break. So we only have a few minutes left here, but here you've seen the common childhood ailments: asthma, eczema, type 1 diabetes, conjunctivitis, scabies, lice, ADHD, iron deficiency anemia, and scoliosis, and lead exposure. Okay, so these are your common childhood ailments. And some of the questions on the quiz were related to that. Okay, and you're going to be covering this, I'm sure, in PEDS as well. But you need to have a good understanding of each of these childhood ailments. There's several questions on exam 1 about common childhood ailments. All right, so I want you to take the time to read through the common childhood ailments on your own. And at the beginning of next week, after we do our second quiz, we'll come back to this to see if anybody has any questions. But these are, you're going to be learning about these in PEDS as well. Okay, so I've outlined what I think are the most important bullet points to know about each common childhood ailment. Remember, if you're working with kids in the community, whether you're doing home health visits or whether you're doing school nursing, you're going to deal with these all the time. Right?
Yep.
Okay. So I want you to read through this section on your own. We did have a quiz question about asthma. We had one about just trying to prepare you for the exam. I don't think we had one about eczema, did we?
No.
We had one about conjunctivitis, ADHD. Okay, so those are the most common childhood ailments to study. Okay, everything is in your notes that you need to know with regards to the exam, and we'll go through that when I do the review next week. So yeah, we covered lots of concepts today. Do you have a better understanding of each of those? What questions do you have? I'm trying to be mindful of letting you go at an hour and a half since we didn't take a break. Does anybody have any questions about the concepts we covered? Now, if you reviewed your readings and reviewed your notes, then this should have been familiar, right? If you didn't, then this was all new information, right? So now if you go back and do your readings and your notes, it will start to make sense.
Can you send us the what was it? The week 3?
Great, yeah. Absolutely.
Is there a possibility of having week 2 and week 1 information on quiz 2?
Pardon me?
Is there a possibility of having information from weeks 1 and week 2 on quiz 2?
No, we have to keep moving forward and do week 3. I like I said, I did mention, I don't want to go through this again. I did mention last week that quiz 1 would be covering weeks 1 and 2. So, let's just go forward. Okay. So quiz 2 is going to be covering week 3. I will send out the week 3 blueprint notes today. Okay. I'll send them out today. I've never sent them out before the announcements on the weekends, but if that's what you guys want, it's no big deal. I have them all ready. But if that will help you, then I'm more than happy to do that.
Thank you.
Okay,
You going over it, it made a lot of sense. It kind of cleared up.
good, good,
Yeah.
good. Those blueprint notes are good. I mean, that's really kind of my lecture notes, if you will. But that's really the details and the most important information to know with regards to each concept.
Okay.
And then the readings support the notes.
Mhm.
Does that make sense? I'm getting a lot of head nods.
Yes.
Okay.
Yeah, the reading is drawn out. So it's like I'm reading all of these chapters. The blueprint kind of like get straight to the point.
Right. So when we do exam reviews, I rely heavily upon my blueprint notes. And I even pull out from all the weekly notes, even more specifically about what's going to be covered on the exam.
Okay.
Okay.
So the chapters in the book for the fundamentals and concept skills for nursing, some of those don't even correlate about what we're talking about. Like chapter 11, it goes into prenatal development of viability and full-term pregnancy and things like that. So I'm kind of confused why we have those.
Well, because one of the concepts to be covered was growth and development. And so that chapter is to give you an overview of caring for kids in the community, understanding growth and development. Okay.
Perfect. All right.
And every bit of reading that you do that's not in your notes is just supplementing the understanding of the concept. Because obviously growth and development is a concept for community nursing, especially if you're working with kids. Like for me, working in the schools, knowledge of growth and development was critical. Right? Because I worked with kids all the way from preschool through high school. So you got to have an understanding of it. And you're going to get that in peds too. Again, remember what I said last week. This class is a culmination of everything we've learned. Right? Taking all those classes and all those tools and all that knowledge, bringing it together and taking care of any kind of client in the community. Okay.
One more question. On our HESI prep assignment sheet, it says that we're going to go over these like kind of each week. So what would be for this week?
So there's not a whole lot for weeks 1 and 2 in the HESI prep, but next week when we cover migrants, farm workers, homelessness, poverty, there's a whole section on the HESI prep about that.
Okay.
There's not a whole lot on weeks 1 and 2. And maybe next week we'll stop before class ends and everybody will pull out. I did this a couple of times last term. It was really helpful. We'll pull up your HESI preps and we can fill those sections out together.
Okay. Thank you.
Okay. All right. So I'm done. Anybody can leave that wants to leave. If anybody wants to stay on with specific questions, please stay on. But it was nice to see everybody today, and I hope you have a good rest of the week.
All right. You as well.
Thank you.
Thanks.
Have a great
Thanks.
week.
Yeah, you too. Thank you.